Hey there, all my friends in Dinksland. It's been a very interesting week, but at the end of every week, or I should say in the middle of every week, is Hump Day Happy Hour, my most favorite day of the week now. It's my favorite day of the week because I get to spend it with the other dentists in the know and with all of you to get your feedback and to have some banter back and forth. So welcome to Hump Day Happy Hour and welcome to Dentists in the Know. We are your backstage pass for current trends, politics, and education in the dental world. It's live. Thank goodness it's over a cocktail after the week that I've had this week. I'll give you a little update on that in just a minute. But first, I have to tell you that tonight's show is sponsored by Spear Education. We are so delighted to have them as an educational partner, and we are so glad to bring you some of the content we've been able to bring you. Like tonight, Dr. Jeff Bonk is with us. We are so excited about this. He does a hands-on restorative program, and we're also going to be talking a little bit about live education opening back up. So we're really excited about that. So anyway, grab your drink, sit tight. Come on in and meet Dr. Chad Duplantis and Dr. Jennifer Bell and myself. I'm Dr. Jeff Horowitz. The three of us are the dentists in the know. We are all educators. We are all dentists and we are all business owners. Our job is to bring all of you in the know. So, my dear friends, how are you doing?
Fine, but I think you owe our audience an update. I think they want to know, they heard all about the flood last week and the heroics that your team went through, the ENT clutch at the end to get you into your office. Where are we today, Jeff? Where are we?
So this is the problem as it is with drugs. Whenever there's a really big high, there's an impending low. It's just that's the way the world works. It's the way drugs work. It's the way alcohol works. You may be low, then you come up. No matter what, you can't land on the extreme. So I was kind of on a big time high. I was tired, but I was so thrilled at the fact I was able to move an entire office in within 24 hours and be open for patients. But then reality kind of sunk in where some of the equipment moving over to the new location, I guess, had been jostled just a little bit. And so none of it was, or I should say it all wasn't working the way that it was supposed to be working. So we had a little of that. We thought all of our electronic communications and phone calling would have everybody just ready to come back at the right location. But no matter how hard you try, no matter how good the technology is, there's still people who say, I never got the message. Just running back and forth between offices, picking stuff up, dropping stuff off. We left this. We can't find that. It's just been a little bit stressful, but we're going to get there. And but yeah, that's my update. So as high as I was riding last week for the accomplishment of moving the office, this week was kind of the let's bring you back in your shoes, Dr. Horowitz. So
yeah, I get it.
That's life. How about you guys?
You know that Andy Williams song, It's the Most Wonderful Time of the Year?
It's the most wonderful.
Yeah, you know that song?
Yep.
Then Andy Williams is full of shit, man. I'm telling you, there's days like today where, I can't remember who told me this, but it's like you're trying to squeeze 10 pounds of shit into a 5-pound bag. And it's like, you've got all these people, and then that one person calls who's the great patient, and they broke a tooth, and they just want you to take a look at it because it's not hurting. And you go in there, and the distal lingual cusp is just like flapping in the breeze and attached to the tissue. And you're just like, this doesn't hurt. And then you're looking at them and there's like a tear coming out of their eye. And they're like, no, it's really fine, doc. Can we just take a look at it and get me back in next week? Yeah. And then you're like, it's just one of those days. It is truly, I do love the holiday season, but from our perspective with between people trying to get in to use insurance benefits, between people trying to get in just because they want to be able to eat over the holidays. They know we're going to be closed. It's just, and people wanting to get in because they're going to be off. Holy crap, man. It has been a crazy week, but I guess you take your blessings when you can. And so I feel privileged to have this problem, but man, I tell you what, I'd like to punch Andy Williams in the throat right now so we can never sing that song again.
JB.
Yeah, I would feel the same pains that Chad is going through. You know, when you do diagnose something in December, something uniquely happens that has to be done in 2 weeks. Like, you know, you can diagnose something in March and you could maybe do it by June, but there's something very unique that happens the minute you say you have this, we should take care of it, or they show up with a limited. Somehow the calendar only has 3 weeks left of existence. There is no January. There is only December.
I'm laughing because I feel it.
There's only
You
December.
verbalized me perfectly.
Yeah. So anyway, but really feeling very grateful. I think in general it feels strong. So I don't know what the economy has in store for us in 2024, but at least it feels good in December. I think many of us experienced a little bit of a lull in the fall, kind of wondering, was this the beginning of an economic reset that we might really be feeling the pinch on? But it does feel like there's a little bit of energy in December. So hopefully that'll carry through 24. Other than that, just trudging along, doing all the normal holiday fun, traditional stuff, and getting ready for maybe a little time off from the office.
I love it.
Yeah.
Oh, and my besties are coming to town this weekend, so I got that going for me.
We didn't even talk about that because so much has happened, you know, at Dentist in the Know, especially with everything else going on. We've brought on some new educational partners that we're very excited about. We're putting together some programs, which we're going to be talking about this weekend. So much happening, and I'm really excited, not just to be planning for Dinks, but to hang out with you two guys.
And I think everybody needs to stay tuned for either the 12 days of Christmas or the 8 days of Hanukkah, just depending upon how many deals we can drum up for y'all.
It's going to be great.
Yeah. This is gonna be fun, but don't give it all away, Chad.
I'm not going to give it all away.
Okay.
I'm not going to give it away yet.
Yeah. Well, JB's not going to give it away. She can keep her mouth shut. You can't.
Yeah, I can't. No.
We all know how this works.
Steel trap.
So anyway, guys, we have a terrific show in store for you today. Dr. Jeff Bonk is with us, and we're so excited to have him. And again, one of our educational partners, Spear Education. They've been amazing. We've had some great speakers. They're putting the band back together. They're doing live programs again. And so we're going to be speaking with Dr. Bonk. But before that, Jennifer Bell, do you have some news for us?
Always. So we've been reporting on this story for the last couple of months. Let's go back to SmileDirectClub, if we shall. Remember, it was just a few months ago that they filed for a voluntary bankruptcy, and they've been trying to drum up enough funding to keep this puppy rolling. They've also had it on the market for purchase, and to date, there is no new buyer. So the deadline was November 23rd, and we have no buyer on the docket. So they're back to the drawing board about looking for funding. The founders are willing to throw in additional funding to clear some of the debt and also re-inject capital for 100% retake of the company. So it'll be interesting to see what the investors will do with this particular offer. Remember, the founders had also injected $20 million of capital just a few months ago to keep it afloat while it was looking for a buyer or trying to figure out next steps through this voluntary bankruptcy process. And now here we are at the end of that deadline, and they are offering to basically take back the company for about a $50 million investment. So we'll see if that is enough for the investors to kind of wipe their hands clean of the company. And also super interesting to see what the founders may have in store for the company to re-energize it and keep it going. They still do have active patients and are still managing patient care indirectly. So we'll see how that shakes out. Another super interesting story. The geek in me saw this and totally freaked out. I watched a bunch of videos afterwards. So there's a company out there that is now starting to master 3D printing of grafting materials. So it's a resorbable material, and I'm not 100% sure on all the technology if it's a resorbable resin material, which doesn't really make a lot of sense, but it's a resorbable material that they are injecting with hydroxyapatite. And why is this so cool? Because two reasons. One, they've already done test surgeries in North Carolina specifically with implants to do grafting procedures in sockets post-extraction. The other cool thing is that the company itself was showing actually printed skull replacements. So if you had to have a surgery or had a traumatic injury, craniofacial defect as a result of a traumatic event, they can actually scan and print, CAD design a replacement for that particular defect. Think about what this does in the maxillofacial world if we can really effectively print a matrix of hydroxyapatite, essentially, for your own biomaterials to then go in and remake, to some extent, your zygomatic arch if you lost it due to pathology, or a part of your skull if you lost it due to trauma or some type of brain surgery. So we're seeing it in very small scale right now where they're printing these materials and using it for implants in dentistry specifically. So it's really cool that dental is part of this evolution of what 3D printing could look like for us as clinicians in the next, decade or so. So I thought that was a really cool story. I'll post a link on that so that you could take a peek. And it also made me think about, are scanning companies really starting to look at that, at where 3D printing is wanting to go and design, and are scanners and scanner companies starting to look at what it means to scan more moisture-rich environments? Are they prepared? Is the technology there yet to be able to do an intraoral scan of an extraction socket or ridge defect? And then we could get, a printed bone material to replace that defect. So anyway, totally geeked out on that. In the last little bit of news, it's a bit self-serving for dentists in the know. You see, last year was kind of our first big year out on the scene, and we were incredibly humbled and honored to win Influencer of the Year with Dr. Bicuspid. Somehow, miraculously, even without me using the @everyone tag on Facebook, you're welcome, we still managed to get in the finalist group again this year for Dental Influencer of the Year. So I'm humbly asking for your vote. It was a great honor to receive that in Chicago at Midwinter last year, and we would be so honored to get your vote again this year. I'll post a link on our Instagram and Facebook pages so you can go directly to the Dr. Bicuspid website for a vote. And what's really cool as we continue to sort of make our way in the dental community, seeing so many friends and different communities that we support and are participating in also getting nominated as well. So it's always a really neat honor to even be a part of a really cool evolution in how we're communicating in dentistry. And with that, that's the news.
Hey, you were talking about this. Oh, hold on. I didn't mean to do that. Sorry. Now we're back in business.
Hi.
You were talking about this this 3D printing of this matrix,
how loud is this?
if you will. My wife's cousin, you met him, Tan, the state senator.
Mm-hmm.
So he is a principal of this company, and what they've done, Jeff will dig this, is they're printing these matrices or stents, if you will, for deviated septum surgeries.
How cool.
And so the way they've printed it, it's a biocompatible material, so it minimizes infection, it stays patent long enough, and there's no recurrent infections after the deviated septum surgery, and then it resorbs on its own. And if it resorbs even to a certain extent, the tissue doesn't completely integrate with it. And, if it's driving somebody nuts, they can pull it out. But I found that to be really cool But this right here is even cooler. I think the sky's the limit. And somebody was asking how, when we could do it in our offices. I don't see that
no
for a
time
while.
soon. When I was to the company itself, and I'll post the video, the company that's manufacturing these, I mean, they're still very much there's like 2 beta FDA testing machines that they're using. And then they've got 2 that have at least been approved for certain applications. And that's what they're starting to put in very limited capacity in the marketplace. The first is, I think currently they're CAD camming this off of some type of hard tissue radiology read, like a CBCT, and using that for the information they need for the matrix. But they're also making just these, like, how you get membranes already, sort of prefab different sizes. They're doing the same thing with these grafting materials. It's just a prefab, like cube or sheet or square, however you want it. And I would imagine you could probably manipulate it, cut it, and change the scope of that. Or you could even just take, like, instead of having a resorbable membrane and graft, you might just put this printed material over top of your extraction socket to close the ridge up and allow your own biomaterials to fill in, just keeping soft tissue at bay, which, it's so cool. And I thought, how neat is it? I've only really thought of all the multiple applications we could really do in 3D printing for resin. And you've got these companies that are now somehow miraculously able to print, I truly believe, like a non-resin type material with hydroxyapatite embedded in it. So really cool stuff.
And it is being used in periodontics in other parts of the world. It's just, it takes a little longer to get through FDA here, but I'd love to bring him on at St. Bart Dental Society meeting, probably about 6 years. Chad, I'm not sure if you met him or not. Anyway, he was one of the speakers there, and we were chatting. He actually showed this in his program 4 years ago, I think. And it was actually a 3D printed scaffolding that you could do one of 2 things. If it was small enough, if you were harvesting autologous bone, you could use that as a guide to shape the bone. So you had your predetermined ridge augmentation, that whatever you needed to properly place the implant, and using that. But he was also printing scaffolding as well that he could put his biomaterials in. And he actually showed cases. So it is being done in other parts of the world right now. So I think we'll see it within maybe 3 or 4 years here, is my guess.
Such cool stuff.
Yeah.
Interesting. Should we bring our guest on?
Would love that.
All right. So anyways, our guest is Dr. Jeff Bonk tonight, and he has been in dentistry for over 3 decades. He's devoted to sharing his knowledge and skills of advanced restorative dentistry. In 2009, he joined SPEAR as a member of the Anterior Live patient faculty, and now he serves as an instructor in the Restorative Design Workshop. He lectures nationally about advanced restorative dentistry. He has provided advanced training in the dental specialties of periodontics, oral surgery, and prosthetics, as well as training in hospital medicine and treatment of medically compromised patients during a 1-year residency at the Loyola University Medical Center. Once a month, he works at the GPR at Loyola Hospital in Maywood, Illinois, and he lectures in Illinois as well about restorative dentistry. And we're just honored to have Dr. Bonk with us this evening. We got to visit with him a little bit before the show, and it's an honor to have you here. And, we noticed you were actually laughing at our stupid jokes. So
I know.
Exactly. We'll take it. We'll take it.
Converting one single person at a time.
Yeah, one dentist at a time. There we go.
Yeah, that's right.
Thanks for having me. It's a pleasure to be with you guys. Spend some time with you, and glad to kind of get to know you. So thank you.
Same.
Well, you bet. And we're big fans of SPEAR, and Ashley Stanford is like one of our favorite people in the world, and I know you've had the privilege of meeting her. But tell us about your journey in dentistry and what got you to SPEAR. I know everybody's, that's a big stage. So tell us what got you there.
Actually, Frank Spear himself.
That's interesting. That's a good way to get there.
It's a solid way. Solid.
You know you're in when you know the owner.
I know, exactly. Rubbing elbows. No,
Yeah.
just, attending, just by way of conversation with other friends and dentists, ended up hearing about Frank Spear from out west. I'm in Chicago area, so Frank, developed his practice in Washington and did a lot of lecturing through the years out there. And then ultimately was starting to do some hotel courses. And one of my Western friends from Missoula, Montana, called me one day and said, "Hey, you got to hear this Frank Spear guy. He's amazing." So I got myself to one of his programs and I watched his images flash up on the screen. At the time, that's 35 millimeter slides right in carousels. But I'm looking at the dentistry going, "Oh my God, I've never seen anything like this." And that's the kind of dentistry I want to do. And so really sitting in that lecture and then attending a couple follow-ups hotel courses at the time was like, you know what, I'm going to reorient my practice to try to do that kind of dentistry. And so little by little, I took education, Frank and some other people, to learn some skills, learn some knowledge, and apply that stuff in practice. And ultimately had the opportunity to then come to Spear and teach as part of the visiting faculty at Spear. Like you talked about in my intro in the live patient courses, that was a great opportunity for me to get more connected with Frank and at that time, Gary Wood and Lee Brady and all the other people that were there, including Frank and Greg, and that just led to me being involved in more workshops and met Bob Winter, and Bob asked me to participate in his workshops. And that's where I stand today. So now I work with Bob directly in two workshops: restorative design workshop and also anterior restorative dentistry. They're kind of a combo workshop, and so now we offer those two workshops are offered between the two about 21 times per year. That's so great. I fly out from Chicago and then spend my 3-4 days there in the workshop. Workshops are 3 days hands-on, and then end up flying back home. But being able to implement those concepts, being able to integrate that material into my practice has helped me evolve into a much better dentist than I ever was. Still striving for more excellence, but doing much higher dentistry, much more sophisticated dentistry than I ever thought. So, and my goal and role right now is to try to pass that information on to the participants that I interact with. And that's really what we try to do at Spear. And that's I'll call that my own personal mission. It's like, if I can help somebody achieve a success, get a level of knowledge or skill, then I've done my job. So thank you.
Well, I think it's fantastic. And we talk to a bunch of young dentists, as they graduate. And so, here you are, you've been doing this for 3 decades, but when did you really realize that you wanted to kind of consume yourself in education and then really want to teach? I mean, did you do that right out of school, or did it take a while?
Yeah, it was an evolution, and it's interesting because I never saw myself as a teacher or a mentor or in some way. And suddenly through, this is probably, I'll say, I've been doing this really more than 40 years now, not 30. But anyway.
I was being nice.
I know. Thank you so much. Yeah. I appreciate that.
I was scattering it a little bit.
But I'll say a number of years ago, 30 years ago, suddenly I got a call. I would start to get these calls from local colleagues of mine, and they'd call me up and say, "Hey, can you help me with this case? Can you help me with this particular problem I have?" And I'm like, "Why are you calling me? What do I know that you don't know?" And little by little, that started to evolve into more phone calls, then invitations to come to study clubs, and invitations to let's say, offer help or support in some way to these dentists. And suddenly I realized that, hey, maybe I have something to give some other people. And I think what happened ultimately, those people recognized I guess I had that. And that's how maybe Bob Winter asked me, Frank Spear asked me to join them. It wasn't that I asked them, can I do this? It's more like they saw something in me that was an opportunity that maybe they could help me become a better teacher, a better facilitator of dentistry. So I never really anticipated I would be where I'm at with that. But it's really wonderful. It's a great fit for what I'd like to do. And as I move forward and I'll say more towards the end of my career, this is a great opportunity for me to share what I know. So,
you know, when you get those calls in the beginning where people are asking you for help, I'm still at the phase where I've got to go to Google to help me help them. It's really nice when you don't have to go to Google, and I'm just waiting for that switch to go off. And so maybe I need to go to Spear more often.
End of Dentistry for Dummies, I think you'll have all the answers that you're looking for.
Yeah. Like how do we utilize this band? Oh, okay. This is what you're gonna do. You're gonna, but it's wonderful, and I love that you're a mentor to many as well. And
thank you.
And I think that's a great journey.
How do you I think we don't talk very much with educators about what it means back in their practice. So as you sort of, you're a clinician, there's a period of time you're a clinician, then you become this amalgamation of teaching and a clinician at the same time. What impact does that then have back on your practice? Maybe personally, mental health, those types of things, but also just clinically. What do you see?
Well, actually, patients recognize the fact that I do a lot of that I'm back and forth teaching a lot. And I think many individuals, you probably see it in your own practices with some of your patients. Patients respect teachers. Mm-hmm. And when somebody says, "Oh, I'm a teacher," or "I teach this," or "I help other people learn that's a powerful statement that people take in, and I'll say they raise you up to a different level. And that I've seen that happen in practice. So patients will say to me, or they'll say to their friends, or even their spouses, whatever. It's like, "Oh, Dr. Bonk teaches, so he really knows everything. He really knows what's going on in the world." And suddenly they start to refer people into the practice because the respect and the thought process behind that is that, "Oh, well, if you teach, you must know it. Therefore, that's where I want to be in my practice." It's not to say that everybody should be a teacher, but if you do some of that stuff, I would encourage people to talk about it a little bit, share that with their patients, and I think the impact will be great as well. Also, the reality is we're all teachers in our practices because we all have a team of people, and they don't learn to do what we want them to learn unless we help them learn that. So we teach people all the time. We as clinical dentists are in the teaching world all the time to help our staff understand what's new, what changes we're going to make, how do we do this, and that's true for clinical things as well as administrative things. We have to help our administrative team learn as well. It's a shared thing, but I think teaching has impacted my practice to a great degree, just by the nature of having that opportunity and by the nature of sharing that information with the people around me. So,
well, Jeff, I have a question for you about teaching as well, because often when we put lectures together, we hope it'll have a certain impact, and we work so hard on certain slides. Like, this is the point that I have to get across. Here's how I think they're going to take it. But very often, the thing that is most impactful is not the thing we were trying to emphasize in the first place. So I'm curious, like, what kind of moments have you had like that at Spear, where you've done this presentation and all these people are going, "Aha," or "This is exciting, I want to talk about this," that maybe you didn't expect, that has now become a bigger part of the program there?
Well, I think how to put it, it isn't sometimes, for me, it isn't so much the in front of the room speaking that raises the aha moments and the student gets the surprise. It's the one-on-one relationship we have in our hands-on workshops. When I'm working one-on-one with an individual over the shoulder to help them achieve a certain exercise, a certain technique, a certain concept we're trying to get across, and suddenly I draw a little picture, make a little image, and their eyeballs, they look up at me and they go, wow, that's amazing. I never thought of it that way. Those are kind of the haha moments that really are most impactful to me. When I can be one-on-one with these people, these participants who are coming to learn, I'll say for many people, they're new concepts, but for lots of people, they're just pearls that they're trying to get to improve what they already do in their practices. But if I can get that little thing across to them, it's really powerful and really engaging. Suddenly, then many times these individuals that have these kind of moments, now they start emailing me. They go, hey, can you help me with this case? Can you answer this question for me? It's almost like we develop this connection, and it's really, really fun and really fulfilling. That's the beauty of not only teaching, but also working one-on-one like we do.
So what I think I'm hearing then is that there might be some inherent value to in-person learning. Is that what I'm hearing maybe?
I think you heard that correctly. I think there's.
I'm just so glad to see it open again, because those kinds of opportunities, it's just you that's how we find our mentors. You can't do that virtually.
For sure. I mean, what Jeff's talking about for the audience is that I'll just throw this out there, is that Spear is now, as of the first of the year, we're offering live seminars on campus now, and there's up to 18 seminars going to be presented in the coming year, and we haven't had those seminars almost for the last 3 years. We've had lots of things virtually, and I know most people have participated in that. But now to come to campus, have that energy, have that experience, and have that one-on-one relationship with the faculty and the team around there, it's truly something we've all missed, but it's truly something that really makes a difference in our learning and makes a difference in I'll say in the participants' motivation to learn more and learn better. I mean, there's nothing that takes the place of hands-on learning, but for sure live learning is really, really powerful. So thanks for promoting that. I appreciate that.
Yeah, I think
excited to see it.
I think we really enjoyed the virtual teaching, the virtual learning for so long. Mm-hmm. But there's so much to be said about the camaraderie and the collegialism that happens when we're all together and mm-hmm. We're actually in person and we're able to, as you said, teaching one-on-one, even those times where you got to put your hand on somebody's shoulder and say,
for sure,
maybe dentistry's not for you.
Well, I'm not sure I go there.
Chad, are you looking for validation or?
Is this personal story time?
Yeah.
Tell me more.
There's a lot to be said about being together in person.
To you.
Yeah. Do what?
Tell us how that felt when it happened to you.
It actually did 2 weeks ago, but it was in reference to my dog. We were at dog training, and I said, "Is there ever a dog that doesn't get it?" And she looked at me and she says, "No, but there's an owner that won't." And I was like, "Oh, that would be me."
Message
like,
received.
you need to spend time with him, So he sits when I pat his butt, but other than that, he doesn't listen to a damn thing that I say. So yes, I do speak from personal experience, not in dentistry though. So,
fair.
Yeah.
So let's talk a little bit about some of the tracks that are going to be coming up. If I'm a new dentist to Spear and I'm looking to engage and get started on an educational journey, what does that normally look like for folks that want to learn more?
Yeah, for sure. The live seminars, of course, I'll promote those again because that's actually where most of the learning really starts. And for sure, it started with me. I went to a seminar, right? And the seminars are generally a 2-day event, 2 full days. A topic, a theme is presented, but basically the core philosophy is of Sphere treatment planning. Facial degenerative treatment planning is the core philosophy that we have, and so that philosophy smattered or spattered about through all the workshops. And so when someone attends a workshop, they start to hear things maybe that are intriguing to them, or maybe concepts that they don't really understand fully. And then what the curriculum format is designed to present a seminar, a theme, and then have a hands-on workshop that correlates to that. So the learning experience works you through the curriculum through a series of seminars and hands-on workshops. And that's what we try to do, so that you not only hear it, but now you do it, you feel it, and you get a deeper understanding of it. So, and there's all kinds of curriculum that we have, obviously, from overall treatment planning concepts to very specific focus courses, implant courses, composite courses, restoring edentulous arch things, very, very focused things. But then there's the idea of treatment planning that goes into occlusion, goes into aesthetics, goes into worn dentition. I mean, taking a patient that has very complex needs, complex situations, and trying to break those up into pieces so that you can understand it, but then you can actually put it all back together. Hopefully that helped understand it, Julie. Yeah, thanks.
So very interesting question came through, and I get asked this a lot, and I'm going to put you on the spot, but I think it's worth asking. So the question is how does Spear differ from Pankey, Dawson, or Coyce? Or in other words, what sets Spear apart? And I know I'm not trying to pit one against another, but what advice, maybe let's ask it this way. What would you tell somebody seeking for education as to why you would suggest going to Spear, besides the fact that
and if I could just caveat that too, that the typical question starts with the discovery of occlusion, like that really, because the ones you're mentioning specifically really are trying to hone in on that piece of dental education that they're just not getting, and they're in practice and they're finding they're deficient or running into obstacles, and they think occlusion is probably the problem that I don't understand. So then it starts to get into these little buckets of which program or institution should I enroll in to learn more?
Yeah, I mean, to answer, I get that question sometimes, many different times from different participants. And actually, I have attended really all of those programs, Pankey in full, Dawson in full, obviously Spear in full, and a smattering of some Coyce things through the years. So, I mean, I have some insights into that and some experience with that. I mean, when people ask me out, well, what is it that they're struggling with? And I think you hit on it well there, Jen, with occlusion. Obviously, occlusion is a big deal. But if you were going to break up the camps, if you will, I would say Spear is a big picture format. Spear is facial degenerative treatment planning. Look at the entire patient from the face, from starting with the face and going inside, right? So all the different components are addressed at Spear. By the time you get through the curriculum, you've pretty much gone inside out with these patients. If you're struggling with relationships with people, relationships with your patients, I think the real strength of Pankey is relationship-based dentistry. Mm-hmm. All four of these areas that we talk about. So if you talk about Spear, Coyce, Dawson, and Pankey, those are kind of the big players, if you will, that are out there right now. The curriculum is similar in how it's presented. The concepts are very similar in a way, but how whatever they emphasize is a little bit different. So again, Pankey's a relationship-based orientation. So if you want to learn about individuals, learn about people, learn about your team, learn about your patients, the kind of individuals they are, Pankey's a great place to go. You're still going to learn technical things. You're still going to learn how to be a good dentist, learn about occlusion, learn about aesthetics, but the emphasis is going to be on the patient. Dawson's more occlusion based, so lots of occlusion. Everything's focused on the occlusal aspect. How do the teeth meet? How do the teeth interdigitate? How do teeth function together? Kois has a lot of aesthetics, but Kois is strong on occlusion as well. So they combine those two things. And yet Spear has all of that included. We talk about patient-based, we talk about patient personalities, we talk about practice administration. We have Spear Practice Solutions as part of our core curriculum. So we bring the administration side into it too, but then we have all the aspects related to aesthetics, occlusion, function, biology, all the different components are there. And we have focused courses on that as well. So you can learn a lot in one entity through Spear Education. It's pretty amazing, actually. So
I would take it one step further too. I agree with everything that you said, and I would have put them in the exact same buckets. But one thing that I would tell people, young people looking, is that there's going to be more than one dentist that you admire the way that they practice dentistry.
for sure.
And they're all going to have sought education somewhere. And if they haven't, then they're truly a diamond in the rough.
Mm-hmm.
But speak with those dentists and find out what made them pursue the path that they decided to pursue, and why they feel so fulfilled after doing so. And I think, your colleagues are your best resources, because you're going to find people that went to each one of these that's going to say that their team was the best, no
Mm-hmm.
matter what.
Right.
But, it's going to be rare that you find someone like Dr. Bonk, who's done several of them and is able to relate to all of them and may be able to help you find where your best path is. But really, your colleagues are going to be your best resources when deciding which path to travel down. And then do your own research and read up on the philosophies and the why, as to
For sure. Yeah, very well said. I mean, to speak to that, I mean, my mentors, we all have mentors. We talked about that. The people that I rely on, that I go to get my answers to my questions that sometimes are pretty challenging, they're actually in all those buckets. It's interesting that we talk about that, because I can name individuals that are highly respected individuals in each of those worlds, but they're people I will go to ask a question, get an answer, get some orientation. So it's not one way, it's not this or that, but you have to keep your minds open and look at the opportunities you have and take advantage of those opportunities and of the individuals that will help you get there. So,
Isn't the takeaway too, it's a lifelong journey? I mean, to your point, you've accomplished and conquered many of these different curriculums, to sort of ultimately, to use a word I've already used and made fun of, amalgamate all of these different philosophies to what works well for you, right? What
sure.
was successful in your hands, what wasn't successful, and it's sort of all of those pieces coming together to make, the Bonk Institute of Dentistry, which is how you practice on a daily basis. So,
we could all be bonkers.
We can
I know, exactly. You go bonkers.
I love that. I think that's great. But to that point, you can pick a camp today, but what you need 10, 15 years from now might be different. You might, need to continue to pursue other avenues. I mean, it's honestly never ending.
And it's okay to do more than one.
Yes.
It is.
I think that's such an important point, because that's how we all grow. And I think I think the first step is just finding a community that you can learn within,
For sure.
and finishing a program and getting some kind of a solid base. And then what you want to know more about, what else you need. But I think it's important to immerse yourself in at least, one tight community where you're comfortable. Learning is not just what you're taught from the podium. Learning is really an exchange of ideas, because I'm sure you'll attest to this, that we learn as much when we teach as we do when we're students from the questions that come up. So
For sure.
I think just finding that right community where you feel comfortable and you feel comfortable exchanging ideas, and it's a great learning environment. I just think you have to go somewhere and develop a be and then you'll figure it out from there.
And
I agree. I think that's really well said. Yeah.
You know, you need to be set in your ways, but open to new opportunities. You know,
sure.
there are very few people. I'm going to venture to say there is not one person out there that does 100% of what they learned from these curriculums. Now they might do greater than 90%. But you've got to pick and choose. You may do 90% that you learn from Spear and 10% of what you learn from Kois. I don't know.
For sure.
But, you know, they're not creating clones. Yeah. They're creating better educated dentists. And
that was really profound from you, Chad, considering you're still looking for that Class 2 institute.
I found it, by the way. I did.
Are you starting it?
No, actually, I did a Google search today, and it was called the Jennifer Bell School of Amalgamatees.
Yeah.
Oh.
Yeah.
It's going to be an amalgamation from the amalgamator of everything.
Oh, that's true. You haven't graduated Class 1.
You haven't graduated Class 1 restorative yet.
Yeah. That's true.
Yeah. Don't start looking at Class 2 till you master that, buddy.
Yeah. Hey, when those self-adhesive flowables came out, I became really good at Class 1.
So, hey, Chad, we'll take you in. Don't worry.
All right, thanks, buddy. I appreciate it. I got you, man.
We're gonna get a coupon for you, bud. But no takebacks. Like there will be a no refund policy. You're on your own.
Kind of like a no credit check guarantee.
Right. Yeah. Exactly.
Hot damn. Hot damn. I'm in.
Oh, that's good.
Yeah. All right. So upcoming courses, what's happening soon? Where can we find you?
There's one happening tomorrow.
Oh, yeah.
Yeah, exactly.
You are on campus now, are you not?
Yeah, I'm actually on campus. I'm in my condo tonight, but we're on campus tomorrow. Tomorrow we start Anterior Restorative Dentistry, which is, I'll say, the second half of restorative design workshop.
Wait, you have a condo? JB, we don't have a condo.
We don't have a condo. We need a destination condo.
Chad, we don't have a condo.
We got a place.
Oh.
I'm sorry. I didn't mean to interrupt you.
Yeah. No. It's good. It's good.
I just had a little condo envy. That's all.
I know. Yeah. Well, I used to stay in the frat house. So
yeah.
You're
Until Kinzer started walking around without socks. Yeah.
Exactly.
I'd have been exactly too.
You're like, I'm out, guys.
Yeah.
I can only take so much.
Yeah. It's hard to unsee this during the day when we're doing direct composite dentistry, and I can't unsee it. So.
So we have a couple of workshops starting this week. Seminars start in January. Workshops are never ending, though. I mean, they come and go. There's a lot of opportunity for learning, a lot of opportunity for trying new things and learning new things. So we encourage all dentists to give it a shot. Come on out to campus and really see the energy, see the excitement, and really take advantage of the learning that can happen there. It's really awesome. So,
Jeff, talk a little bit. Do you participate or teach with their online, with Spear Online and that whole curriculum?
Yeah. So we as resident faculty contribute to that. I don't take an active role in doing virtual seminars, but I do a lot with Spear Digest. That's the article piece or the content piece. I do a fair amount of that. I do a fair amount with Spear Talk. That's the forum that we use to communicate, to get answers, get suggestions, get ideas and direction. I do a lot with those two pieces. And I do some recording of content too, not to the level that Greg does or Bob does, but for sure, all of us have recorded content that's online that's available for different topics, different themes, different things. I mean, Spear Online is incredible.
It's incredible.
The amount of information that's there that covers the amount of territory that's available. You think of anything and you can find it in Spear Online. It's pretty amazing. So to have access to that is really powerful. It's a powerful learning tool. It's better than Google.
Yeah.
I've plagiarized several articles from there. It's been fantastic.
Perfect. Yeah. Go ahead and do it.
But no, I'm glad you touched upon that, because I meant to mention that earlier. That's something that you want to look into when you're looking into these programs as well, is what's the continuity when you're back in the office.
Yeah,
for sure.
And what's available to you. And as a member of a study club, you get access to the online library, the articles, the on-demand, and it's been a really invaluable resource for our study club. But I think one of the best ways before you immerse yourself in a school of thought is to start maybe with a seminar. And I believe that Spear has extended us an incredible offer on one of their seminars. And so we'll be sure and share that with anybody who may be interested. But really, really thankful for what Spear has to offer to our group, and thankful for people like you.
Yeah, well, thank you. Yeah. I mean, it's been a great opportunity for me to learn and for me to grow in my own world, but to see other people learn and develop is pretty powerful, and it's a great resource for people. So great environment and great people to be around. And don't forget about all the team information that's available online as well. I mean, as much as we want to learn ourselves as docs, we have a whole team of people around us that have to learn and have to support what we want to do. So that whole online content has a lot of team support as well. So
I'm so glad you said that, because I think that has long been the missing link for education. It is so easy for one person to go and sit there and then try to relay that to their team. In fact, I put a post up about this just a couple of weeks ago. I'm like, you go to a great course. What is the first thing you do on Monday morning to get it all implemented? Because there is no way any one human being sitting in any of those courses can have the bandwidth to get all of the team on board and remember all of the things that were talked about, order the right products, implement the right products, learn the technology that was talked about. So it really does need to be a team effort. When you bring education back, it has to be, this is your responsibility. This is your responsibility. This is your responsibility. And learning how to delegate those things, I think, is it's been such an important missing piece in education. So I'm really glad to hear that.
Yeah, thanks. Yeah. No, it is really important. And we speak to that often in the workshops, that, it is about the doctor in the workshops, but more importantly, it's about the team at home that has to help that doctor implement, maintain, and integrate this material. So whatever we can do to help them is really, really important. And I know that from my own experience, trying to come back from different workshops or different seminars and trying to implement some of the concepts that I was introduced to. I'm so excited about, and all the pushback that happens. So it's helpful to have, in the world of Spear, we have Spear online team meetings that will address very specific topics related to some of the seminars, some of the workshops that are there, to help get that stuff integrated. We can't operate without our teams, right? I mean, I don't know what anything is in the office. I mean, I can't even open the door.
Imagine moving to a new office in a day and no one knows where anything is in the office.
Yeah.
Even the bathroom. Exactly. I mean, we're bound down to basics here on day one.
Exactly.
I got a portable compressor and a drill.
Looking for action. Just
What
looking
kind of
for
bird you
something
got
to
for
do.
me? Oh,
That's
boy.
funny. So, yeah.
Well,
So
thank you so much for joining us. It
You're
was
welcome.
really a pleasure.
Thank you. Thanks for having me. Thanks for hosting us. Thanks for supporting Spear as you guys have. It's great to have that kind of connection, and it's great to be able to share what we can to people that haven't been fortunate enough to hear from us and haven't been fortunate enough to participate at all. So we really appreciate your words of support and the everything that you offer for us. Thank you. So.
Well, thank you so much for coming. And as we reach the end here, I just, want to once again thank you. I want to thank Spear. And Jeff, do you want me to close this out, or do you want to close this out? Or
do. Yeah.
JB, you want to close this out?
Go for it, Chad.
Well,
You're on a roll here, man.
Yeah, you're good.
Enough. Like, let's
You're
let
just
you
going to
have
tell
your
JB
moment.
to do it, and then I'm going to say, Chad, you do it.
No, you do it.
Well, as we come to a close tonight, I just want to thank everybody for being here. As always, our focus in Dentists in the Know is to keep you in the know, and that a big part of that is through education. If you notice, there's a common theme of our group, and it's all educators in dentistry. And tonight we had a fantastic one in Dr. Bonk. And so as we close tonight, I want to thank Dr. Bonk. I want to thank Spear. We are going to have a special offer from Spear for all of you to attend a seminar. Is it just for a seminar, JB, or is it?
There's been a couple of different ones
because
we've had some recent ones. So we've got workshops and we've had seminar things, and I think they're extending them out for a few more weeks. So, but definitely will not last much longer.
Well, we will get that posted tomorrow, and I would like to educate everybody on something as we close tonight, because I believe I was shot down earlier, but just for everybody's personal information, there is a North South Carolina. Now, I was wrong. It is not south of Greenville. It is south of Columbia, which for all I know, that may be south of Greenville too. I don't really freaking know. But I just want to let everybody know that there is a North South Carolina that is south of North Carolina, and it is also south of Columbia, South Carolina, but it's north.
321.
What road? That is the road to nowhere.
Yes, and I believe collectively there are about 16. So I would not recommend anybody open up a practice in North South Carolina. However,
we cannot miss the fact that North is north of Norway and Sweden.
Yes, that is true. That is true. It's in the fjords of South Carolina.
And a Sweden, South Carolina.
Yes, in the fjords. Yes. All right, everybody.
Again, this is why
let's do our first Dinks outing in North South Carolina.
There we go.
All right,
there you go.
Have a good night, everybody.
Thanks to all our special friends out in North South Carolina.
Thank you so much. Thanks for having me. Take care.
Thank you.
Good night.
And that wraps up another podcast for Dentists in the Know. On behalf of Dr. Jennifer Bell, Dr. Chad Duplantis, and myself, remember that we've got a great profession, so let's make it a great day, Dinks.